Hi everyone, today we are doing injection of salmon sperm into the face. Now this is an intradermal injection of polydeoxyribonucleotide, PDRN, say it one more time, polydeoxyribonucleotide. What we're going to do in this injection is we're going to inject it subdermally and intradermally. What does that mean? That means it's injected right below the epidermis, very close to the surface of the skin, and you're going to see this remodeling of the skin a little bit. Now the challenge with the injection is it hurts. So we have to make the patient comfortable. To make the patient comfortable, we do 2 layers of anesthesia. First, topical numbing cream, it's already been applied. Second, we're gonna do a nerve block. Now, there's various nerves that come out of the face, but there's 6 big nerves. First, the supraorbital nerves that come out on top, which we're not numbing because we're not treating her for it. That applies sensation to the upper face. Now, the mid face is primarily given sensation by the infraorbital nerve. That comes out along the infraorbital rim, along the midline. I'm going to show Daria those nerves, I'm going to show you those nerves. We're going to block that nerve. The second nerve we're going to block is the mental nerve, which is a continuation of the infraorbital, of the inferior alveolar nerve. So the mental nerve is going to come out below the second premolar. So we're going to numb those. So we're going to block the lower face and the mid face. Now, why are we blocking that? Look over here. So for Corinne, who's an amazing person, one of the best people I've known in my life, we're going to go ahead and we're going to treat the lower eyes, and we're going to treat the nasolabial folds, we're going to treat the marionette lines. So we want to numb these areas up. So by doing targeted numbing shots, everything's going to be numb. Let's do it. We're injecting your tear troughs and nasolabial folds, so we want to get the infraorbital nerve, okay? Now the infraorbital nerve comes out in the midline of the infraorbital rim or the eye bone. So what we do is we take a gentle feel. Can I take a feel, Corinne? There's an indentation. And it's right in the middle. You can feel it, and right below the nerve comes out. You can feel it right there. You're gonna feel it. Right there. And we're gonna go along the bone. 1, 2, 3. We'll poke. You get 1 cc. Sorry, friend. That's it. And we'll go on the other side. You okay? The same thing, we're gonna take a feel. We go straight on, 1, 2, 3 on the bone. Now you make sure you don't miss the bone. If you miss the bone, it's a problem. So you feel it, straight on the bone, 1, 2, 3. So you see right there, perfect. Look for the second premolar. So these are her central incisor, lateral incisor, canine, first premolar, second premolar. So the mental nerve comes out around the second premolar, right there. So what I do is I look for the corner of the mouth, a little trick, and I go straight down on the bone. Now we've identified our second premolar. We're gonna go ahead and feel for the foramen too, because we know it's a combination of arts and science. Go all the way down on the jaw, 1, 2, 3 on the bone. Inject 1 cc. But we're injecting salmon sperm, DNA from salmon sperm, in the face to help grow more collagen, thicken the skin, tighten the skin, improve darkness or hyperpigmentation, and decrease the vessel show you see underneath the eye. So we've already done our infraorbital block and our mental nerve block, and now we're going to inject. So we use a very small needle, and we're using our PDRN injection. You want to rest back, Corinne, for us? And we're going to treat what's called a tear trough, okay? Now we're gently going to pull her lid down. We're going to go directly underneath the skin and inject. You can see that blood forming? Fantastic. Now we'll do her nasolabial fold. Let me know if you feel this. Feel that? So for our post-care injections after PDRN, polydeoxyribonucleotide injection, or salmon sperm injection, this is DNA from salmon sperm that's been extracted, purified, cleaned, injected. The post-care instructions are, number 1, it's going to look bumpy and swollen for about a day. There might be some bruising. There's going to be some swelling for approximately 2 days. It'll settle and things will get better. Now, like anything, there are risks. Blindness, blood collection, fluid collection, infections, skin reaction, allergy. So we make sure we screen the patients so they're safe for the treatment. We advise them that this treatment is available. It's an option. Now, the use that we're doing is not FDA approved. This is considered off-label. It is not an FDA approved treatment. We tell the patient that we counsel them, and if they want to try it, we can do it under safe conditions.